Hi, how are you?
Okay. All right. Let me get a
So,
little comfortable here.
thank you for joining me. This is the first time I've ever hosted a Zoom webinar myself. So, there might be some glitches. I was just explaining to everyone before you jumped on. I want to say thank you so much for joining us from the East Coast.
Absolutely.
So,
Thank
one
you.
screen, we have one side of the country and the other side of the country. I'm in California.
Oh, what part of
So,
California?
right now, we're sheltering in place in San Diego.
Oh, okay.
My son and I both have stage 4 cancer, and in my home we have 2 essential workers, high exposure jobs. So it was thought by his oncologists and my oncologist that it would probably be safer for us to stay here.
Oh, okay.
So that's where we're at.
Are you feeling safe?
I'm feeling, yeah,
Okay.
safe is our norm. This is, I'm feeling lonely.
Sure.
You know,
Sure.
we're in the Ronald McDonald House, so they're fantastic. They are really, really good,
That's
and
awesome.
it's just been myself and my soon-to-be 10-year-old. He'll be 10 next week,
Oh,
and
okay.
right on the freeway. So if you hear the freeway, I'm so sorry. I've got all the windows closed. It's just really
That's
loud.
okay. No problem at all.
So again, like I was sharing, this is not for any kind of medical purposes. This is just opinions and information. Only this will not take place if anybody's speaking to their own doctor about their own children and all that kind of stuff. I just want to kind of throw that out there, and I'll say that a couple of times, just because I don't want anybody to think especially now in this day and age, of a lot of Zoom telemedicine, that this should take place of their own personal doctor. And in no way, shape, or form is that
Mhm.
possible.
Okay.
So,
And just, I don't know if you're comfortable with me mentioning it or, how you like to do things. I do medical educational consultations for people around the country. So I'm not serving as their physician. We actually signed it as an educational consultation, not a medical consultation. But I'm able to, well, for all things in my practice, that's true. But for this, I'm able to kind of like understand what a person's cannabis needs are. I'm able to like, go online and look at the dispensaries that are by them, and I can kind of help shop with them. If you,
that's
and kind of
amazing.
point, yeah, and I can share all of my, of course, all of my dosing protocols and all like that.
Awesome. We'll
Yeah,
we'll have that information available if as that goes after this. That'd be fantastic.
yeah,
I don't know how to put it up there now. I'm not really
yeah. Or
tech savvy.
if you're comfortable mentioning it or asking me about it, or.
Right. Awesome. So how did you get into this whole cannabis and kids thing?
Well, I'm a holistic pediatrician. I've been using herbs and supplements in kids for over 20 years, since back in my days of my residency at Tampa General. And so for me, this was just another herb, whereas for most physicians, it was obviously incredibly new
Right.
and scary, and obviously a certain cultural consciousness has happened, but obviously the stereotypes as well. But because I've had to put individualized treatment protocols together on a case-by-case basis for my patients, for me it was just again just another herb, because I knew how to create individualized treatment protocols patient by patient. And so and that helped me figure out how to, in my opinion, how to dose this in a way that's not too aggressive and not too conservative. Like I try to, my practice is always trying to be Goldilocks, like kind of finding right the sweet spot.
Yeah. I know when we started looking for cannabis for my son, he was 4 years old, and California had barely passed the legality part of it for medical use. Finding that information was so hard for us. I'm so glad you're here to help us with other patients. I'm just going to kind of jump in because we've got quite a list here of
Sure.
questions, and you've got about 90 minutes ish. If you want to go longer, you can go longer. If not,
Okay.
but I just want to kind of jump in. A lot of these questions that our readers and viewers have to do a lot with, of course, medical things, but a lot with mental health. Have you found this something that I believe is really overly diagnosed nowadays with is ADHD?
Okay. So I have to at least talk a little bit about the broader scope of my practice, even though I realize we'll be talking about mainly cannabis. But, being a holistic pediatrician and being based in a functional medicine root cause perspective, um, there are many tools that I have at my disposal in order to try to maintain homeostasis in the body, whether we're looking for toxins that we want to minimize, food reactions we want to obviously eliminate, to nutritional deficiencies that we could potentially boost. Okay, so all of those things are addressing the getting the body into the best balance, the best homeostasis. So the way that cannabis plays so well with this is the understanding of the endocannabinoid system is completely about maintaining balance in the body.
Mm.
Whether it's a nerve that's overfiring, underfiring the endocannabinoid systems, and instantaneously able to identify when one cell is bothering the second cell to send that signal back to the first cell saying, hey, chill out. And that in a nutshell is how kind of the endocannabinoid system works. And the analogy that I like to use is kind of like when you take your kids bowling. So we bowl, maybe roll down the middle, we end in the gutter. But when the kids put their little the rails up, if it goes too far left or too far right, it pushes them back to the middle, right? And so that is what I think of as the endocannabinoid system. But then I also look at the plant-based cannabinoids is building bigger rails. So now, because you could throw a bowling ball so bad it could hop a rail, but build bigger rails, like, you have an Indiana Jones ball rolling down the middle and you keep it down the middle. So the plant-based cannabinoids is able to enhance the system in that way to give us bigger rails.
That makes sense. Yeah, like I said, I personally believe that ADHD has been like overly diagnosed nowadays. But we've had a lot of our readers are really concerned with it, and they would like to know, do you think that cannabis can help with ADHD?
Oh, I can tell you that it does.
Absolutely.
I've seen, and I've seen CBD work for it. I have also seen small doses of more sativa leaning types of products. I'm more focusing on terpenes and helping people understand the various terpenes and using the Leafly strain finder by putting the terpene profiles in, so that we encourage all of our families to read the different terpenes and then decide, hey, this is what sounds best for my kid. And a lot of the limonene and there's more stimulating medications used for ADD are stimulants. So using a terpene that has a stimulant type of quality to it, more of that pep, is how I believe that's helping that. Now, of course, and one of the things I'm also interested in is, being able to develop CBD strains, hemp-based strains, but that can bring out things like those terpenes, like the limonene. So I think that could be a very powerful tool. I do teach parents about microdosing of THC, so that way you can do small enough doses to not give that intoxicating effect. And I also talk about how CBD potentiates, it can minimize or even stop the intoxicating effect of the THC if enough is used. So, I also suggest start the CBD first, bring up the dose, see what you got. Then bring the THC in, but more slowly, and in terms of our doses, and then kind of see how that balances. And if you gave your kid too much THC and your kid is looking high, don't do that again. Bring back the THC or bump the CBD to see if you can kind of bring that down again. So that's an important part of how I'm approaching it from an ADD ADHD perspective, is kind of like by bringing those in, and that can be really helpful. And I've also found that patches can be effective because it's a slow dose being released all day long. So if you don't want to or can't do to school, dose your kid multiple times during the day, then patches is a potential really beneficial thing. And it is probably the most expensive way of using cannabis, because it's a lot more to the process of making it into a patch with that delivery system that's slow enough that it's not going to hit you all at once, but also enough to make it happen. So, so I kind of always talk to parents about really focusing on oral forms first, see what you can do, see if you can get the dose close enough to not have that dip that can happen. And, and I do use a fair amount, again, not in school with kids, but, I do have families who are teaching their children how to use vaporized products in order to get that fast action. And that's especially true with my kids with autism, who have like these incredible meltdowns, temper tantrums. And so sometimes they need to use that for the fast action, but also some families needed to fill in the gaps between the oral doses kicking in. So there's a lot of different tools that I have in order to kind of find that right sweet spot.
All right, let's real quick. You hit on something that I was going to talk about a little bit later, but we've had a couple questions come in about it. Let's talk about the high or the intoxicating effect real quick on kids and cannabis. I don't know if you have a little bit of background about myself. I have 2 children on cannabis. One is on a high CBD, low THC, and one is on a high THC, low CBD kind of thing. I have a cancer kid over here, and I have an autistic ADHD kid over here.
Okay.
A lot of people are very concerned. They don't want their child to get high or to get stoned. Where can you tell us the similarities and the differences between the intoxicating effect of THC versus, say, an ADHD med that's a stimulant, or morphine, or pain pills for kids that have chronic pain or cancer, or somewhere along that lines? Can you draw some similarities so parents can see that it's not the big bad drug we were, quite frankly, we were trained to think of it as
yes, certainly. So, first and foremost, it's important to acknowledge right off the bat that this is about proper informed consent, which means that we have to weigh the potential benefits, weigh them against the potential risks to determine what's best for your child. And every child is different. Again, every child has its strengths and has its weaknesses. So we need to weigh all of those things to determine what the best thing is. I have some patients who we've tried lots of natural things, and it turned out the best thing was a stimulant medication. So again, I look, as a holistic with a pediatrician, I use all the options that are available to me. So that being said, and that's one of the things also, and this is more when I talk with kids on the spectrum, especially lower functioning. And I kind of differentiate a little bit between the concept of being high versus being stoned. Okay, being stoned, you're dazed out, you're zoned out, you're thinking of what a typical stoner would be. But being high, we all want to be more high in life. If you're down, you'd like to go up. Okay, so I tell the parent, if your kid is happier, if your kid's more socially interactive, if your kid's more wanting to hug you, that's a beautiful thing. If your kid's not able to function, coming back to the concept of functional medicine, then we're doing the wrong thing. So if we make a change and your child is functioning better overall, whether that's academically, socially, or behaviorally, then we weigh that against, well, what's the negative? Well, my kid's a space cadet. Well, the reality is I rarely hear that that's actually do that. And if the parents, we educate the parents. If your kid's doing that, we need to scale it back and we need to make a change, to it. So. But we make ourselves available to our patients. So again, there's always going to be a little rocky road, especially when you have a kid on the spectrum. And so that we need to be agile. We need to be able to make changes as we go. But as opposed to the other medicines that you asked about, obviously nobody's, it's a rare kid who's put on a morphine patch or medication for a long term. Obviously, that's usually more for a short term situation. As far as the stimulants themselves go, it's a mixed bag. I mean, because I see that because one of the interesting things about stimulants, similar to cannabis, is that the effect is seen right away. An hour later, you know what you got. And you can make a change the next day if it was the wrong idea. You can take weekends off. You don't have to dose it all the time. You can kind of play it as is, as needed. So there are actually some similarities that way that I actually have found, being it's a very different biochemical situation using an amphetamine or stimulant medication versus a plant substance. But it is interesting that there are actually some more analogies between the two than what you'd actually until you take a step back and think about it. But if asked, we have to be serious about this concept. We know that brains are still developing until age 22. Okay, we know that THC can have an effect on cognitive function and memory, and it seems because the brain is more pliant until the brain is fully developed. What impact that may have on a child's development relative to an adult who's been developed, and that's a fair question. And at least we know that kids who have been put on Ritalin and Adderall, now it's been around for all of my career for over 20 years now, so we now know how those people are 15 years later. So we have that information, so again, I'm a very data-driven person when it's available, and when it's not available, logics and instinct gets me very far.
Yeah, we have one of the questions we had, which I'm glad you touched on, was long-term cannabis use in kids. Kids 4, 5, 6 years worth of use. I know my cancer son, he also has epilepsy. The difference between pharmaceuticals, epileptic pharmaceutical drugs versus his cannabis, he is much more, he's a kid compared to the little zombie that he was when he was on his anti-epileptics. But we're asking, and we're having people ask, what about, have you seen learning disabilities come up with kids who've had long-term cannabis use, specifically with the CBD and THC, or is it better with CBD or without CBD, or with THC or without THC? We just had Ollie's he had a full psychological workup, and he does have significant learning disabilities, but we can't tell if it's from the cancer, the chemo, the cannabis, or just plain old genetics, because we have learning disabilities that run on both sides of our family. So you have the DARE proponents that are like, it's because he was on cannabis, and then you have the others that were like, well, you guys don't know. So do you know of any studies that have shown or disproven whether
No, I am not aware of any. Because of ethical conditions, it wouldn't have been until very recently that people could have studied that. Obviously, to answer that question properly, you probably need to be looking at kids 5 to 10 years into this. So I don't think that that type of long-term exposure. If you ask, is it a concern and is it something that I'd speak to with every parent? Yeah, it's something that I do. I tell parents, I'm not scared of THC. I'm just cautious about THC. Do I, again, using my logic and instincts, do I think that CBD will have an impact on that? I'd be really, really surprised. I don't think that that's what's happening. But again, I don't know. Right. But at the same time, I do think there's enough information known about the effects of THC on brains, even that are done in adolescence, more so than younger kids, adolescents have certainly. And I think that there is. Now, granted, I have a lot of adolescents who are doing so much better at school since they switched from stimulant medications over to cannabis, and I have some of them who are using predominantly THC. And their parents are sitting there right next to them saying, yeah, my kid's doing so much better. School's going so much better. He's so much more calm and he's more agreeable with us. And, it's kind of doing the way that, when you think of what cannabis does to people, chills them out, makes them think a little bit more slowly, clearly, thoughtfully. Well, that would be something we would like our teenagers to probably do more. Not that I'm advocating that everybody start using it, but, in those types of situations, because I do work with a lot of kids with anxiety too. Adolescents. I worked the gamut with seizures. I have seen people come off of anti-epileptic medicines using CBD. Some of them we have to bring in the THC as well, but mostly it seems in the seizure world, it definitely seems that it's a CBD predominant thing that's going on there. So it's just
Ollie is very, very high CBD, very low THC. Yeah. Basically, the THC is only there for the entourage effect.
Right. Yes, and of course. And it's interesting because now that you'll start seeing with products that are like an 8-to-1 ratio, so it's mostly CBD, but there's just a little bit of THC in there. Sometimes all of those products can be really helpful also because I tell people, however, when I'm introducing dosing to people, I encourage them not to get ratioed products because I want to start the CBD before I bring the THC in anyways, but also if you have a mixed product, you can't increase or decrease one without increasing and decreasing the other in the same direction. So I prefer, as I figure out what your ratio is, if you find out that you're at 4-to-1 and there's a similar terpene profile to a 4-to-1 pre-made already, great. But what if your ratio is 5-to-3, 7-to-2? You're probably not going to find a pre-ratioed product like that.
Yeah, finding a dispensary or even a compounding pharmacist that works with isolates, cannabis isolates, is fantastic. That's what we use for our family. Is a compounding pharmacist here in California that does it, and we really did find for Ollie, it is a big, his ratio is weird, and Joey, he's higher on the THC side. My son went from not being able to sit still and he couldn't even read, because by the time he got past the first 2 or 3 letters, he'd forgotten what the first letter was and putting the sounds together. He wasn't reading more than 1 or 2 sight words before starting cannabis, and he was in the 2nd and 3rd grade. We started the summer between 2nd and 3rd grade, and by the end of the 3rd grade, my son was reading Harry Potter.
That's awesome.
So he went from reading nothing to just, now he is autistic. And I put this out there every time. I say this is not typical of most autistic kids. Most autistic kids have their thing. Joey still can't write his name very well, but he can read at a college level. He's 6th grade now. So, he putting 2 and 2 together for math is not going well for Ollie, but he can read, and so it's, every kid's different anyway, even without having to worry about other things in. So I like the idea, what you said with working with the isolates. We have some people that are wondering about asthma and other lung things. Like, what are your thoughts with cannabis and asthma, and even things all the way up to like cystic fibrosis?
Okay, so we know that one of the main things that cannabinoids do for us is reduce inflammation. Okay, so any hyperinflammatory condition, whether it's allergies or asthma, autoimmune conditions, lupus, thyroid, rheumatoid arthritis, hyperinflammatory conditions like Crohn's disease, I can certainly give you a way longer list than that. But all of these have in common that the immune system is behaving badly. It's attacking us, or it's making immune chemicals that's hurting us. Okay, so any condition where there is a hyperinflammatory component, an overactive immune system, cannabis certainly has an opportunity, and I would be willing to try it on pretty much anybody who has any of those types of conditions. Okay, again, we asked ourselves the pro versus cons. Would we necessarily want somebody with cystic fibrosis inhaling it? That would be a little bit different. We would want them smoking it, or not, maybe, dry, again, but what I think that doing, we know that inhaled treatments for cystic fibrosis can be helpful, in general. So, I wonder what, again, I'm always a little bit more thoughtful and conscious about vaporizing oils, because even though it does seem that the vape lung injuries that were being reported last year were more about vitamin E acetate being there as a way of diluting the substance, and those, you haven't heard about those even before coronavirus hit, because the street people stopped using it because it wasn't good for business when people were dying. But the dispensaries, I've never heard of a dispensary having a problem with this. So, but at the same time, I do question, do we know what inhaling oils, period, for 30 years, 40 years, 50 years, et cetera, and we don't know, we can't say. But that's why I'm also a big advocate of vaporizing the dry herb, because then you're not getting any smoking, there's no combustion going on. You get the entire entourage effect of the plant, but you're breathing it in just as the cannabinoids and the terpenes, but you're not bringing in any other oils like you would be in a lot of, whether it's a concentrate or whether it's a more 20-25% THC type of product or CBD product. It's in oil. So I'm looking at ways, how do we not inhale oils unless we have to, Right. So it's the same, another consideration.
I'm going to take one of the questions here from on the chat thing that's coming up. You mentioned allergies. This one mom says her son has allergies year-round, nasal congestion and a runny nose, and asthma that kicks in from time to time. She doesn't like to use conventional meds, but had to use albuterol when the breathing gets difficult. Please help me with some natural meds.
Okay, so again, I think that CBD is an excellent place to start for something like that. Okay, and again, how much THC comes in, obviously that's an individual thing and how one approaches that. But part of my bigger picture concept from that homeostasis is, what's the kid's vitamin D level? We try to get those kids levels, in the 60 to 70 range. What's the kid's zinc level? We try to get them around 100. Whereas if you look at what the reference range is, my kind of general rule of thumb is aim for the middle of the reference range. If the vitamin D reference range says 30 to 100, don't accept a 31, aim for a 65. Right. If the zinc level, say normal, is between 50 and 120, aim for 90 to 100. So that's part of, so I don't look at cannabis at all as a cure-all. Okay, I will tell you that it is the absolute best single supplement that I've used in 20 years of practice. I have seen it help more people and have less side effects than anything else that I've seen out there. So, but I also think, there's more to it than just cannabis, and that's part of my more holistic concept.
Right. So are there anything that you would suggest for allergies that's natural?
Yeah, there's certainly things like quercetin, and again, getting the vitamin D level and getting the zinc level is critical. I had allergies starting when I was 5 years old. I made the symptoms go away at 35 when I did elimination diet. When I brought food back, I found it was corn that was my trigger. 3 times in the next 10 years, I accidentally ate something with corn and went anaphylactic each time. Then I found my vitamin D level was low. I got my level up to 70. I can eat corn with no problem now. So again, we shouldn't downplay the importance of those, and of course, looking for the triggers, whether it's environmental inhaled or environmental swallowed. Obviously, if you're being exposed to a trigger, then minimizing that trigger. Now, a lot of times, thankfully, when we get the immune systems more in balance, I do a lot of checking of the, for candida yeast, especially if kids have been on a lot of antibiotics, which kind of goes along with the ear infections and all of that. So, that's helping heal the leaky gut and getting the gut ecology, getting the good flora there. So all of those things go into making a well-balanced immune system. Avoiding sugars and simple carbohydrates, and avoiding all the food additives and the chemicals and colorings. These are all things that we've only been introduced to for a couple of generations, and humanity has been around for a lot longer than that. And evolution can't keep up with that kind of change.
True. Speaking on that leaky gut thing that you mentioned, a question here that was submitted to us a couple of weeks ago says, my grandchild has a condition from birth called tortuous colon. She's been tested and does have nerve responses, but still doesn't empty her colon without laxatives, enemas, and a special diet. This has also caused bladder incontinence. There doesn't seem to be any answers to correct her condition. Surgery and or like a colostomy is being thought of, but everyone, including the medical establishment, is trying to avoid that because of her age and ramifications in her life with this. It doesn't say how old the child is, so my guess is she's pretty young. Have you had any thoughts or experiences with a tortuous colon and needing to empty your colon?
Yeah, and without knowing enough about this case, I'm just going to talk in general terms. We know that the function of the bowels is such an important thing, and there's lots of things that I can do to keep bowels going. Okay. Now, again, without knowing the specifics as to why things are not moving through, and I tend to find those things. I mean, for instance, I've had people who have told us, and it turns out that they were sensitive to casein and gluten. This is one of the things that we found with kids with autism, is that it's not that they're having an allergic reaction to it, it's not an immune reaction. Some kids are not breaking down the casein and the gluten protein fully, and the partially digested protein has the same chemical function and structure as opiates, which we know cause constipation. So I've seen casein and gluten and soy-free diets clear that up, right? It's not a mainstream concept. They'll do an allergy test or a skin test and it'll show negative. I'm like, that's because it's a digestive problem. That's like saying that I'm not allergic to milk, but I have a problem because I'm lactose intolerant. I'm still sensitive to it, but you do the milk allergy test and I'm negative for it, but it doesn't mean I should never be drinking milk. So I'd have to know more about it, but working with a functional medicine pediatrician, and as I said, I'm happy to take anybody on because I can do educational consultations anywhere, patients anywhere. But taking a more functional medicine approach is for sure the way that I would like to approach before taking pharmacological or surgical interventions.
Okay, let's do another question from live right now. Sophie says, I'm very open to your suggestions. I have cut out dairy and trying to cut gluten. I also use EO and take him, oh, it must be your child, take her out for hikes. He complains that his ears are blocked and have done tests, I guess, but it's still probably due to nasal congestion and running nose. Is there something we can do holistically and naturally for nasal congestion and like the
Well,
runny nose?
I mean,
and allergies and
again,
stuff?
for everything that I mentioned before, you can stamp that to this conversation too. Again, it's an immune system that's overreacting. Do I find that if I can get a kid to use like a neti pot or a nasal rinse with a distilled water with the saline in order to keep those areas flushed through, I think that's always a helpful thing. But again, to me, it's all about looking for the root cause, and that's a term I'll probably say again. But if you don't dig to see what the root cause is and you're just treating the symptoms, then obviously, and not just that, finding the root cause, which is an imbalance in the body, can often help something else, or could prevent other problems down the line.
And that's just detected with like a simple blood test?
Well, no, that's what I'm saying. I mean, again, I don't want to generalize because I'm not going to say it's complicated because I can explain it to a fifth grader, okay?
Right.
But it's a lot of considerations that we would want to talk about. And, and I cast a pretty wide net. I do stool testing. I look at a lot of the genetics, especially like MTHFR and methylation and how, the genes that are involved with inflammation, the genes that are involved with how we transport nutrients through our bloodstream and how we absorb them across the lining, how we activate them. There's things that you can do about every one of those issues if you run the right test and you know what to look for. And it's more of a functional medicine, but it's a pure genetics test, and it's nice because it doesn't change. You have your genes with you for the rest of your life. But there's a lot of information now that in terms of chronic disease, it may be only 10%, 20% that's genetic, and 80% environmental, whether it's environment as in what you're eating, what's in your food sources, and where we talk about organics and farm, factory farm type of fooding versus organic and free range types of foods, the pesticides that we're exposed to. So I mean, again, it's a whole life kind of concept, and it doesn't mean everybody has to do all of those things. Right, but I mean, just knowing the Dirty Dozen versus Clean 15 for food pesticides, which is, if you Google that, Dirty Dozen, Clean 15, you'll see it immediately. We know that there are certain conventional foods that are much more likely to have high pesticides than others. So
Right.
even if one can't eat organic all the time, they can still choose which foods they that they're going to allow themselves to be conventional with. So mold in the house, so I mean, again, we can, I can give you a very long list. And again, I don't check for all of these things for all people, but when I ask questions and they're like, yeah, it seems to be that way since we moved into our new house. We're in Florida. We got humidity here. Guess what? You got mold. It's a little different where you are. You have different issues out there. But, again, so all of those things go into play when I'm trying to put together a plan and then prioritize. Okay, let's focus on this first and let's do this. And, I try not to do everything at once because that can be a little overwhelming to the system. So I kind of have like a more first tier things and second tier things.
Okay, that makes sense. A lot of this is, like you were saying, whole medicine, your whole body, where you live and everything. And so we asked the others, not just medical, but what are your concerns and stuff? And one thing we've had, one woman says, as my child approaches their teen years, I'm concerned about how this stress and anxiety and even depression levels change with more schoolwork and peers and eating disorders, blah, the whole list of everything that goes on with adolescents nowadays. Can cannabis help with reducing stress and anxiety in children?
Well, there's no doubt that many a person will have a more chilled and positive outlook on life when using cannabis. But before we talk about that, not just does this particular child have a therapist, I believe we all should have a therapist. I believe we should be given a therapist the day that we're born, and and have that little life coach there to go along the way. But cannabis is, again, it may make you feel better, but how does it, taking a mindfulness therapy approach where you can identify what are your triggers, how you can identify when you're escalating, how you can identify how to deflect and think happier thoughts, more productive thoughts, how to not let yourself get into the funk in the first place. Again, and cannabis could be an excellent part of that because we know how it can expand the mind. We know that it can make us see things from different perspectives, but I still think it's best to have a professional who can then kind of lay down the track for you, and give you those tools. And can cannabis then say, I see what you're talking. I did that. You know what? And then you start to get those synapses firing the way that cannabis can do for people. And make a person can see things from a different perspective, but not everybody can find that different perspective just on their own.
Right. Along that line, we have someone that says she's concerned about the dangers about potential addiction to Adderall for her child, which is absolutely, you know, being a chemical amphetamine that's there. But is there an addiction? Is cannabis an alternative to Adderall? And is there an addiction component for cannabis as well?
Good question. Let me say, again, I certainly write for a very small amount of stimulants compared to most pediatricians. So the experience that I'm talking about is mine, and also recognizing that I don't just take people off of stimulants with a cold turkey, not even on the weaning, but I do all of these other changes first. If a person comes to me saying, I want my kid off of Adderall, I say, great, let's make these changes first, and then let's see what we got, and then we can talk at that point. Mm-hmm. So that's a big part of it. I've never seen anybody physically addicted to it where I couldn't get them off of it. And when you think of addiction as going through withdrawal and those types of things, and if you think about it, with stimulant medication, since you can take holidays and weekends and vacations off, and kids do not go into that drug-seeking behavior. So I don't know that, I mean, yes, I know it's a concern, but I haven't really seen that happen, you know, and it's not something that as a pediatrician that we're hearing tons about. So that's at the first point, okay? Now, there is no physical addiction that a person can get to cannabis. It doesn't work that way. That's not how one can build up tolerance. Our endocannabinoid receptors can become oversaturated, and a person may need to take more of it to get the same effect. But we also advise people about this, and we tell them if that happens, take 2 days off to clear out the receptors, and they seem to get a reset. And I have some people who just, when they see that happening, they'll just pull back. I have other people who they just take 2 days off a month, you know, or 2 days off every 2 weeks to reset those cannabis. So, and then to kind of do that. But in terms of physical addictiveness, going through withdrawal, there isn't that. Now, could it be, well, I feel so much better on it when I stop taking it, I don't feel good? Well, yeah, it didn't cure anything, okay? If a person was feeling really good on their Prozac and they stop taking it, and they say, oh, I'm not feeling so good, whether you say, oh, you're having, you know, or even more so than that. If a person is doing well with Prozac, and you say, you know, would you say to them, oh, you're addicted to it, you know, you need that stuff? No, you'd say, I'm glad you're feeling better, right? So I look at cannabis the same way. Yeah, I look at it the same way. There can be a psychological dependence, as in, I feel better when I take it, so I want to keep taking it. Mm-hmm. But I would say that the same thing is for the person who does well with a antidepressant. I use those two interchangeably when asking that question.
That makes sense. Thank you very much for that. Let's grab another question off of here. They're coming in really quickly, so I'm going to scroll up to see one we haven't gotten yet. One woman, Ashley, says, I had been giving my daughter Tylenol and Advil every day for 60 days. Until I knew I had to stop. She has chronic pain. What could I give her to help her pain?
Well, again, you know, I've seen wonderful things with both CBD, THC, and combinations. And again, you know, I'll sound like a broken record when I say, you know, start a CBD product, work up the dose, see what you got, and then if you need to bring in the THC product, see what you got, and then if you feel like that you're okay weaning down from the CBD just to see if a little bit more of a THC effect will happen, or you know, so. But again, most important thing, and just my general guidelines, is make one change every 3 days, whether it's increasing the dose, or if you're going to add a second product, or if you're going to change the products or change the strains. Yes, we all know that the effect of cannabis is going to be there with the first dose, but you may have had a particularly good or bad moment or a good or bad day. But if over 3 days, you're going to have a pretty good idea as to what this is doing for you. So, you know, when I talk to people about, you know, how, you know, bringing things in this, we just talk about, you know, how we're going to dose those things in order to do that. And, you know, depending on a person's situation, I dose differently, whether it's an older kid, young, adolescent.
She has a follow-up question here that does say, yes. What dosage? What do I start at?
So in general, I look at in kids, I look at using 5 milligram intervals, you know, 5 then 10 then 15, 20, you know, 1, 2, 3 times a day, depending on what a person's needs are or as needed. When I make jumps of THC, it's more of like 1 milligram, 2 milligram, 3 milligrams. So I start lower and I jump slower. But I think that if you take that as a general, and again, there's definitely more nuance to that and how to time it and all the other stuff that I talked about. But in general, I think that that's a very sound, again, not overdoing it, not underdoing it type of dosing. The reality is when I do a consultation for cannabis, and the number one thing when I ask them about CBD, they say, yeah, I tried it, it didn't work. And then I say, well, how much did you give? Number one answer is, I have no idea. Number two answer is, oh, I gave 3 milligrams. I gave 3 drops. I'm like, I talk to people about working up to 50 milligrams 3 times a day for CBD as just without even batting an eye, and so that's the first thing. Or the second thing that they'll do is I say, what product are you using? Or they'll read it in the back, and it doesn't say how many milligrams of CBD it's an over-the-counter product. It says that it's got 50 milligrams of hemp aerial parts. Well, I don't know what that means. That's not all, it's more than CBD. There's lots of aerial parts in hemp, and so I don't know what that means, and so it's very rare that I'd probably say maybe no more than 20-25% of the time, it's not very rare, where a parent will tell me that they tell me something and they actually got it right. Or not that they got it right, but in a way that I can say, oh yeah, you did give that a good try. That's the uncommon situation.
That was us in the beginning with Oliver. The good news is we had our pediatrician is like you, very open to cannabis, and he told us right off the bat, don't even start this here. I want you to start up here. And when Ollie started, Ollie was 4, and he has Langerhans cell histiocytosis, and he has the neurodegeneration part that goes with it, as well as risk organ, like long list anyhow.
Sure.
The day that he started his cannabis, he went a whole year, 8 months and 12 days without a seizure. And he went 2 years and 6 days without having to take any of his, anything more than Tylenol for pain. So,
yeah, I hear these things.
But we were lucky with him.
Right.
With Joey, we weren't so lucky. It took us almost a year to get where Joey is now.
Yeah, but you got there.
Yeah, it did. Yeah, we stuck it out. Let's do another question here real quick. Her name is, it comes a Drep, says, my 8-year-old nephew has a form of autism and extreme anger and frustration problems. He refuses to do his schoolwork even though he is extremely intelligent. He gets angry so easily that we are on guard every minute that he might be violent toward his siblings. He has been hospitalized many times just this past year for being a threat to others and or himself. Is there a protocol to helping a child when he is having an extreme anger moment? So like an emergency protocol. Yep. And has cannabis been shown to help calm an angry child with autism from day to day? Can I say something real quick before you do it? Coming from a mom's point of view, where she could have been talking about my kid right there. We have had good success with it. It took us a while to get there. We had to find out what worked and what didn't work. For Joey, we had to figure out how to get him to open his mouth to take oral stuff when it came to, because he was so angry we couldn't get close to him. He was banging and punching and kicking and fighting. You don't want to get anywhere near here with the teeth. They hurt. And trying to put things in there. He's crunched through syringes trying to get them in his mouth. We actually had to use topical oil and use it behind his ears, the bottom of his feet, and his wrists, because that's what we could reach. So that's what we had to do. That's what we were advised to do. But again, it took a while to get there. Okay. What are your thoughts?
In those situations, I do find that inhaling is a very helpful thing because of how fast onset it is. One of the ways that we have available here is like an asthma puffer, like a meter dose inhaler. And if you put it on a spacer with the mask, because if you put something straight up to your mouth, the likelihood you can hit the back of your throat anyway. But with the spacer and a mask, the only thing you need to do is to have a seal around it. So your kid's not going to bite you because hey, you're further enough away here. But puffing, your kid's going to breathe no matter what. Okay, and this is why it's also good for seizures, because again they're still breathing. So by getting that, once they've taken 3 breaths, they've taken the dose, and they had to do it. So that is one of the most helpful for those. I do have a fairly large number of families who have taught their even low functioning kids on the spectrum to do vaporizing cartridges. In Florida, we do not have Flour is not allowed to have for kids under 18, which is very unfortunate because I would rather them be dry vaping it. But they do that. But the thing is this, the kids most of the time realize it makes them feel better. And once they see that the effect is, they're pretty open to doing it again because they're going to feel better. And so, you realize, hey, there's actually something that I can make myself feel better. I realize many kids on the spectrum can't verbalize it, but their action can. I mean, I have some kids will be like pointing to the parent to give them a dose because they can feel that they need it. That's pretty good that we can do that. But, speaking about autism, which I also just want to make a point of, I find it probably is the single most effective treatment that I've used for autism in 20 years. The very interesting thing is that even at very high doses of THC, very high doses, doses that you would think it'd get an elephant high, and their parents are telling me that they're not acting high. Great, and these are even people who are not using a lot of CBD. Now, back at the end of 2018, there was a very well done study that showed that kids with autism have lower circulating anandamide, which is one of the two natural endocannabinoids, the other one being 2-AG, but in their bloodstream, they have lower levels of anandamide, okay? CBD slows down the breakdown of anandamide, so it's basically bumping it, keeping around longer, the anandamide. So that's why it's helping some people. But then I asked, well, is the problem maybe they're not making enough anandamide in the first place? Not to say, if there's not a lot being made, then you're boosting not much, because there's a too low in the first place. So I think that the reason why THC has been such an incredibly helpful tool for these kids, adults too, not just the kids, for people with autism, is I think that it's stimulating these receptors that were never properly stimulated, in the first place. And so they're just kind of using, what most people would use a THC product to kind of overdo that receptor in a way, more so than we can. But maybe just these are bringing them up to more levels that most people would have around. Now, this is a theory. I don't know how I'm going to prove this. But to me, I've found over the years that again, coming back to logic and reasoning, and I like to use the term biologically plausible when I do my explanations of things. And that's a very biologically plausible situation.
Let's go into another one of our pre-asked questions. Again, back to teenagers. My child is self-medicating with alcohol. He's a late teen. Can cannabis help him from getting him away from wanting to self-medicate with alcohol? Is it a good alternative to alcohol for self-medication?
Okay, that's a fantastic question. And I would say, again, looking as to why somebody's needing to self-medicate and addressing the root cause, whether it's on a biomedical perspective, working with a mental health counselor, mental health therapist, is going to be so incredibly important to get to the root cause of why the person is self-medicating. Now, that being said, if you put the binary choice in front of me of a teenager self-medicating with alcohol or medicating with THC, in all honesty, and that's the easiest question you will probably ask me today. Recently, it was shown, a big article in JAMA, that when the bunch of researchers tried to figure out what the are you hearing? You froze. Can you hear me?
I can hear you just fine.
Oh, wow, you keep a very straight face there. I thought you were frozen there for a second. I'm sorry.
No, I'm paying attention.
Yeah, but there was, I'm sorry. For a moment, I thought maybe I lost you there. And they tried to figure out what the safe amount of daily alcohol is. This is for an adult. The answer that they came to was 0. In terms of the effects on brain cells and on liver cells, there is no. Even how they say drinking a glass of red wine for your heart, they found that there's more damage to the body done than what the benefit to the heart is. So that, from that perspective, that makes it a super easy concept, okay? Yeah. We do, again, what effect it may have on their long term. I mean, again, I know people who are completely functional. I know people who have used cannabis since high school, and they're very successful people now and went to the top schools and the top colleges and top medical school and law schools, and they're doing fantastic, So again, there is that perspective, but that's not going to be everybody. And again, if that person, if knowing underlying is happening from a mental health perspective, I would be very concerned that kid could just become a pothead because they don't have the base, the foundation to have a healthy life, to go out and do well educationally and make wise decisions. If a person's choosing, to self-medicate with alcohol, they're by definition not making a wise decision. So already we know that that person's judgment is clouded. Not their fault. That's what alcohol does. We know it is a very unfortunate thing that our society has gotten into. And of course, why I've forever ever said that if alcohol and tobacco are legal, how can cannabis not be? That was my first paper that I wrote in college. Was on that, and it was supposed to be a 3-page paper. It ended up being a 12-page paper that every single line was cited from the library at our college. Got my first A. But and I talked about everything from the purity and eliminating street crime to taxation and all the other stuff that we all know about, which is come to fruition now. But I was back as an 18-year-old in 1987. That was my first paper.
You're dating yourself.
Yeah, it's okay. I'm 51 years old. I'm proud of it. I don't feel like
you don't look 51.
Yeah, thank you. So I mean, certainly if that was the binary choice in front of me, yeah, do it in a heartbeat. And if they like it, get them off the alcohol. If I could, if nothing more, getting them off the alcohol by using cannabis, that's a righteous thing. Okay. Can it be successful? And actually, because again, most people, when they properly use cannabis, and again, this is where finding the right strains is, and the ones that's not going to dope you up, but many a kid or a person who that story is could do phenomenally well with something that's in a more sativa direction, because of that improvement in focus and that improvement in mind opening, that ability to see things from that bigger perspective about yourself as well as the world around you. So, again, it needs to be done in the right way. But, somebody came to me and said, hey, can you please give me a safe protocol for consumption of alcohol? After I got off the floor laughing at that question, I'd be like, we have to talk here. Of course, besides the fact that every person who heard me just say that would say, that is the most ridiculous thing that I've heard all day. So yeah.
Yeah, you mentioned the sativa part of it. Some folks are not able to, they don't know the difference between sativa and indica and a hybrid, or, which is better. From a medical standpoint, say for mental health, which would you recommend, more of a sativa or an indica, or would you, like you said before, just stick with isolate?
Yeah, well, no, well, to tell you the truth, I'm not a big user of isolate, so we can't do the compounding here. So so what I'm doing is just being more strain specific, and using terpenes to find the proper strain. And again, using Leafly, which then tells you where you can get it at, which dispensary have it. You can even set it to, strains near me, so that they're not telling you where the location is in North Dakota. I don't know if it's there yet, but you get the point. Yeah, okay, it was Washington State. We'll use that. And so again, finding the right strain. But the thing that makes sativa, many may know that the terms sativa, indica, and hybrid are kind of being phased out. Not at the dispensary level, but more on the connoisseur level, I guess you could say, where people really understand the medicine level of it. So that's why I say sativa leaning, or sativa-ish. Sometimes I'll use that term. But again, understanding what those terpenes are and what they can do. And so, again, a lot of people with mental health issues, because of the way it helps them see things more clearly, helps bring them up. That's why often things in the sativa direction. Now, there are some people that's too much of a sativa direction could increase anxiety or panic. Probably we all know somebody or some friend in high school who had major anxiety or panic attack, and they think the cops are coming or whatever. Now, granted, a lot of people who had those, it's because back then it was illegal, and now for many of us it's legal. And so the anxiety of when's the cops coming is thankfully no longer a concern for many a person, for a good percentage of Americans. So in fact, I one of my dear friends who is also a patient, and he always thought that sativas were bad for him, and he thinks that he had negative reactions. And he, we talked more about the terpenes. He said, okay, I'll give something a try. Tried some, I believe it was White Buffalo is what he's using, and he's like, zero anxiety. I'm so much more productive in work. I'm so much more productive around the house. I'm got good energy. I'm not getting that lull that I would get off of the indicas. So, so there's that. But there will be the outlier of somebody who does have those issues. Say, you know what? Indicas are what works best for me. So that's where it's trial and error. One of the things I strongly recommend people do is, besides making the changes the way I said every 3 days, but keep a spreadsheet or a log. And spreadsheets in fact easy to do, because you can, for each day of the week each day of the month, have a line of what you used, how many milligrams of it, and then for the core symptoms that you're focusing on, whatever it is, that you want. Scale from 1 to 5 or 1 to 10, where you can say, okay, I mean, this isn't a scientific study, but you know what a 10 day is like, and you know what a 1 day is like, or you can imagine how bad it could be if you're not there. And just, spend 5 minutes, 2 minutes every night, and just put a score down for each of those things with that. Because not always is more better. And you may have been doing better a few weeks back, and if you're like, what was I doing? Because I've been making these changes every few days. If you don't have that documented, it's going to be a lot more difficult to kind of get back to those types of things. So that's a really important recommendation also, is track it in a manner where you can use data, even if it's subjective data to better guide and know where you're going to go.
Absolutely. Let's grab another question here. I see a couple of them come up regarding COVID-19. My child has a history of allergies and asthma. Are they more susceptible to COVID-19? So I guess this is stepping away from cannabis a little bit. But then she also adds in, what about my older son's recreational use of cannabis? Does that make him more susceptible to COVID-19?
Sure. Okay, so I think we need to break down the route of administration here. Okay, so using CBD and THC topically or orally, nasal sprays, suppositories, whatever, not inhaling it, would be a great way of approaching chronic inflammation of those types of allergy, asthma types of things without doing anything to irritate the lungs. Again, we do not know what inhaling oils are going to do. We know what burning it, combusting it into our lungs do in terms of slowing the respiratory tree, the cilia that moves everything else up. Okay, so do I think that non-inhaled ways would be probably the best thing to go? For sure. Do I think that if a person were starting to get any type of respiratory infection, whether it's COVID or anything, if they start to feel that throat tickle, you start to feel a little cough, stop inhaling it, switch over to oral. You may have your desire that you want to do this. I get that. But, what do we know right now is the biggest issue with COVID? It's the inflammation. That's actually true for every disease. It's not the virus itself that's causing the problem. It's making our body have an immune response to it. And some people get an overreactive immune response, and that's why some people may have viral-induced asthma, or why COVID is attacking some people's lungs so much more. It's an overabundance of our inflammatory markers, interleukin-6, interleukin-1, that seems to be going too high. Now, one of the things the endocannabinoid system is trying to keep those things more in balance. Again, haven't proven this. We haven't looked at that at all, but the biology of it is that's what it does. Right, and I use other long-term anti-inflammatories like omega-3 fatty acids, curcumin. So there's lots of things that I can do. Again, low inflammatory diets. Things that don't make as much of an issue. So again, look at the whole concept is, what can I do to keep inflammation? We need some inflammation to fight off the infection. So again, kind of in that homeostasis way, how can we let our immune system do enough to fight the good fight, while it doesn't do overboard and then cause problems? When we get mucus, that's not virus pouring out of our body. You will find viruses in there, but it's the immune response to it. The mucus is our immune response. When we're coughing, we're trying to get it out of our body. Coughing is a good thing. Which is why using cough suppressants is not such a good thing when your body's trying to get something out.
Mm-hmm. There's another one here that was just put on that regarding COVID-19. It says, in light of the current situation, there is a concern that medical exemptions for vaccines are going to come under more attack, and that the government is going to attempt to make their new vaccine mandatory. So I'm guessing of the COVID-19 vaccine. Is there a cocktail of holistic herbs or medications, to flush out vaccines if we are forced to take them?
Okay. So I think we need to take 4 steps backwards on that. Okay, all good points, but I want to dissect that a little bit. Okay, first of all, we have to understand that that's not going to be a federal decision. That's going to be a state's decision. Those are under the realm of states. Okay, so every state's going to attack it differently. We obviously know what happened in California with vaccine rights already. So obviously, do I expect a state such as California relative to the states in the South, in how that's conversation's going to go? Especially since a lot of the states in the South, which have religious exemptions, and recognizing that typically right-leaning states have more into religious rights, and so when legislators are beholden to their constituents, that in Florida they tried to pull the same thing in California as they did in California this past session. It didn't even get to the first committee. To a broad perspective, the feds do not have that do not have that type of authority unless they declared martial law or something extreme. Which again, I guess I can't predict how everything will go, but in general, that's going to be a state's decision. Okay. Until we know what is in a vaccine, I can't possibly speak about how we could detoxify it. Okay. However, there are things that we have in our immune support protocol. In fact, if you go look on the blog on my website, you'll see dating back to about March 4th, where I started posting articles about ways to strengthen the immune system in this day and age.
What is your website, real quick?
Yeah, it's holistic with a W. Familycare.com is my main practice. And Holistic Relief with RELEAF, like play off of the word leaf, but they're both with a W, holisticrelief.com. But the reality is, if you put my name in David Berger under cannabis, you'll probably find this, but you put Florida in there. If you put my name in as Holistic Pediatrician, David Berger, you'll find me there too. It's kind of it's these days, yeah. But that's an important thing. But if you look at those blogs, you'll actually see that I've listed right there to open for the public domain different protocols. You'll see a coronavirus specific again, immune support protocol. I'm not saying that it's going to cure everything. I couldn't possibly make that kind of statement. But there are things that I've seen over the years have boosted lots and lots of people's immune systems for all type of things. And there is a reality. Pardon me, I don't know what's going on there. There's a reality that in our practice, people who follow our holistic approaches, both in terms of the long-term, getting the D and the vitamin D and the zinc and all of those other things dietary right, and then certain supplements such as high doses of vitamin A for just 2 days, things like elderberry, things like, I use something similar to echinacea called Larix, which is a arabinogalactan, a good jump of zinc. I actually have dosing protocols for both prevention as well as the treatments, and so they're varying doses of those things. So that is out there for everybody's public domain. Feel free to use it, pass it along. I didn't feel that it would be proper for me not to share this information, since I realized that there's very, very few pediatricians who will put this stuff out there, or even who know about it in the first place. So that's all there, and so I would encourage that. There are certain, the same immune protocol, or what we give in our office for parents who choose to give vaccines, we give them the same immune protocol for the high dose vitamin A plus the zinc, the C, and the arabinogalactan before and after the vaccines to help strengthen the immune system in the first place. I'm also, and coming back to the inflammation stuff, I'm also a very big user of glutathione. Glutathione is the body's naturally most important detoxifier, especially of heavy metals, and reducing of inflammation. So, I put a lot of people on that anyways. A lot of my kids on the spectrum take it, as long as it's called Cetria. Glutathione a lot of people sell it Cetria. It's many brands, but the Cetria is one that's been clinically proven to work in a good study at Penn State. So all of those things we give around the times of those vaccines, and we rarely, again, we do take a different approach to vaccines in general to our practice, in terms of deciding what we believe that a parent has the right as well as the responsibility to do their research and to decide what's in their child's best interest. And whether a family chooses to do all the vaccines, none of the vaccines, or somewhere in between or later, I believe it's my job to educate them on the pros versus the cons, so that they can make informed consent, coming back to that concept before. And then I believe that we should respect the parent's decision to do that. So we do take a very different approach in the first place and do that. And we give these supplements beforehand. I have a preconception to infancy project that I've been working on for a while, where we're literally addressing the nutrition of the moms preconceptually or during the pregnancy, in order for them to have the healthiest baby with a good immune system coming out. So, we're kind of creating biochemically different people than what is happening in mainstream American medicine. And so, again, I've written about this. It's kind of one of my side passions, because healthy babies obviously is the most important thing that you could do for your life, is be healthy the day you're born, and kept that way.
Right.
Not a radical concept there, right? And that's where when I was quoting before about the how it's looking like 80 to 90% of this is about nutrition and what we're exposed to, and not genetics. The genetics could be the final trigger that maybe makes somebody really, really sick instead of just a little sick. Again, we don't, that's a supposition. But, again, we take all of those things into account. If a person has MTHFR mutations, I definitely want them on methylfolate before giving them a vaccine. Why? Because you can't make glutathione and do methylation, which is how your body detoxifies metals. And granted, there's no mercury in the vaccines. They pulled it out. There's still aluminum. I am seeing a lot of kids with more lead these days. And again, glutathione can help minimize that and excrete that. So again, there's not just one answer, but there are definitely a lot of things that we can do, and that we coach people just individually through also, because I don't think a one size fits all approach. So these are just general recommendations.
Agreed. Let's take another question real quick from the one submitted before. Let's see. Here's a good one that kind of goes with what you were doing. How can I ensure that my child is getting a balanced diet and is being nutritious as they grow? Are there wellness doses for kids or medical cannabis supplements?
Okay, so I wouldn't know. I don't know that if I'm willing yet to say. I could probably make an argument how CBD is good for everybody, and we all could use that as part of our wellness thing. I cannot in good conscience say, especially for kids, that that's true with THC. But again, coming back to that, I mean, I don't know whether it's 1 milligram or 3 milligrams twice a day, once a day. That's the right thing for CBD to give us our wellness. Okay, small amounts. Am I concerned about it in terms of coming back? What's the potential benefit versus the potential risk? Okay, again, we're playing on a really good side of that seesaw. So that's really nice. But again, the proper answer from a nutritional perspective is getting the vitamin D levels checked. We check ferritin for iron stores. We check the zinc levels. We look very a lot at people's thyroid levels, and we look at all of the values. The importance of reverse T3 and blocking thyroid hormone. Again, that's another thing that I won't get into detail now, but that's a hugely important thing. Adrenal function. So again, all of those things affect how we metabolize our food, as well as just how our neurotransmitters work. But from a purely nutrition perspective, the only way that you're going to know for sure is doing a nutritional evaluation. So a nutritionist who I trained and who's now been practicing for a while now, she does Zoom or Skype consults with people, and they just send her a 3-day food log where we can figure out on average what's the patient taking, and then we can see exactly for their height, for their weight, for their sex, for age, for everything. We can then determine what is the optimal nutrition for that person, and then we can tell them how to fill in the blanks.
Mm-hmm. I like that. We have another one that says that their pediatrician is straight up not open to any alternatives other than conventional medication. How can they? I always say, how can we be polite? And basically, I wasn't polite when we had a neurologist that was like, no, don't do it. And I said, well, I'm going to do it anyway. But how can parents, that's the number one current barrier that came up when we asked, what are your current barriers to achieving, getting this for your child? Number one was that their pediatrician just wasn't open.
Okay, well, I guess if it came down to it, nobody should see a doctor that doesn't fit them philosophically. Okay, to be the nicest person in the world, most pediatricians are super nice people. We go into this for because we have a care for children, and we care for humanity. Every pediatrician that I know is good intentioned. Okay, some of them may be encouraged by the drug reps. Let's use that word. Maybe a stronger word. But you have to find somebody, and again, you may find somebody who says, I'm not going to endorse this, but I will follow you as your child's pediatrician. And if they say no, I would definitely say find somebody who can. Okay. Now, again, there are people, I know other functional pediatricians as well, but again, that's the reason why I do offer educational consultations where I can interpret lab tests. I can tell people how to get lab tests if their doctor won't. We encourage them to have their local doctor order it, but there are ways of getting lab tests done through. Now there are these like concierge types of labs that have doctors who will do a quick consultation and order labs. So they establish a doctor-patient relationship the way they're supposed to. They're licensed in the state, and so they're labs who work with physicians just to do that, or nurse practitioners or whatever. So again, hopefully you can find somebody who's at least not going to kick you out of your practice. But let's face it, if they're going to kick you out, if they want to kick you out of their practice, you should run from their practice, because you obviously are not connecting at that point.
Right.
You're going to be afraid, and you don't want to be afraid to call the doctor if something's going wrong, or then to say, oh, well, that's the person who did that. I wonder what else they're doing. So again, it's a struggle. And I know some people live in towns where there's only one pediatrician for 50 miles away. So I realize that, that every case is different, but that's part of the reason why I wanted to make myself accessible to people who weren't local to me, and, why I do telemedicine. I mean, I know everybody's doing Zoom these days, but we've been doing Zoom for several years, and I've been using some form of telemedicine and phone medicine for almost 20 years now. So
I'm
it can
glad
be
you
done.
touched on that.
Yeah, so that's important, but finding somebody that will be able to provide the information, because, it's not the type of thing that you want to go alone.
Virginia writes just a few minutes ago, she wrote, I like that you are addressing using cannabis in children. I have a question and input on another treatment concept, but I don't want to interrupt the purpose of this webinar. Is there a way I could be in touch with Dr. Berger relating to learning disabilities and anxiety in children in a natural way and not in conjunction with cannabis?
Yeah.
So she says she has to be signed off by, so she's signed off by now by 6 p.m. But she can be reached, and I have her email here for you if you want that later.
What I would encourage you to do, because I'm not comfortable reaching out to somebody without them reaching out first, but if you can pass along my contact information, that would be what I'd be more comfortable with.
Yeah, I think I'll have our social media people and our contact people either just put your info out there.
Sure.
One thing that's our number 2 barrier that folks are coming up with, not just the pediatrician not wanting to, but it's the financial issues. Finding a doctor that's maybe outside your medical group or your insurance and the cost of that. And then you add into the cost that cannabis is not covered by insurance. I know for our family, cannabis is our second highest bill of the month after rent. And then, I mean, even our car payments, we can make 3 car payments with how much you have to put out in cannabis every month. What do you say when it comes like, what are your financial part, advice on that?
Yeah, it's a very good question, and one, that I wish that there was a great national answer for. Okay, one thing that a lot of my patients do choose to do is they will typically take an insurance policy that has the lowest premium and a higher deductible, just to kind of cover emergent care. If God forbid you had to get a hospitalization type of thing, where, just to save you from financial ruin type of thing. But then they find that the money that they're saved on the premium, then they can use it the way that they want to use it, in a more consumer appropriate way. So that is one of the ways that I have seen people, at least make that shift. They're spending the money anyways. Most, how many people actually hit their deductible where they're actually getting to use their insurance in a more profitable? Yes, but look at your situation, right? And that may even be more people who are talking to hearing now. But certainly, even I can tell you from the feedback that I get from my patients that even the ones who are doing a lot of biomedical, they're like, hey, I'm saving $10,000 on our family's premium right now. I'm not spending $10,000 in your office, that's, not even spending half of that, over the course of a year. So again, it's just when you take a, kind of looking at those types of things, sometimes there are creative solutions to it, also, again, I know that some doctors are us too. I also had mid-level providers like nurse practitioners and physician's assistants who see patients at a lower hourly rate also. So that was one thing that I made available, because I realized that, I realize it's sad to say that I realized that I'm not affordable to everybody. And it's one of the things that breaks my heart.
Okay, Dr. Berger, I did get, I got a paragraph from our person who couldn't raise their hands.
Yeah.
It says, my name is David. I'm the one who asked if I could ask my question because of my physical disability. I want to say I love Dr. David Berger. I first met him on Julie Matthews, his first Nourishing Hope for Autism Summit. And my question is, how do you mask the taste of cannabis so that the kids are more likely to take the medication?
Okay. Yes.
Also, do you know of anything about a new book bundle that the Sacred Plant is coming out with that goes with this conversation and the answer session? And is there a way for me to interview you, David? Because I have a website and a web show called Unlocking the Key to Autism, where I educate people about autism.
Yeah, get a hold of me through my office. We can arrange something in terms of that. As far as hiding things, okay, well, and in our practice, we actually have a list of 25 ways of getting kids to take things, just in hiding it. One of the things that I have found to be very helpful of recent, especially because you're dealing with with drops, sometimes with more concentrated drops. But the new water flavor enhancers, like where the Kool-Aid used to be in the supermarkets, and now they have the water flavor, and they have more natural versions. They're not all going to be high fructose corn syrup, etc. I know that they sell them in health food stores as well. But you have the gamut of every single flavor on the earth right there in front of you in that aisle. And just adding one drop, I mean, that you typically put like 3-4 drops into your the water and flavor enhancer, so you can explode the taste buds. Another thing that I found very helpful is honey, and especially which we call making a honey spoon, where you first put a little bit of honey on it, and then you put the drops in, and then you put some more honey on top, and it's almost like a honey sandwich, even though it's all technically liquid. And again, that honey, but honey's a great masker of things if your kid likes honey.
And honey is also really good for natural. If you use local organic honey, it's great for bringing in allergy.
Yeah, I use that a lot. We work them up. We rotate through the seasons. We have local beekeepers that we work with. So yeah, I'm very familiar with that too.
David, the person who asked the question, not Dr. David Berger. Actually, I have somebody here that I want to help give you that question, answer that question for you. My son has taken his headphones off, and he wants to answer the taste thing for you. Hold on just a second. Ollie, come here. He's been so good for this last hour being quiet. I just want to say.
I didn't even know there was somebody else there.
My son is, he is quarantining with me. Both we're here at the Ronald McDonald House because we both have stage 4 cancer. And we have 2 essential workers that work on the front lines in my home, and it's just safer for us to stay here. Ollie, one of our writers says he would like to know what's a great way to mask the taste of cannabis.
Just put it on a pink marshmallow.
Okay, so I make marshmallows with honey and actual marshmallow root. It's a pain in the butt, but we do it. It's sweet, it's sticky, and it really does mask it. Another thing we've used is something that's kind of highly allergenic. We don't have the issue in my house.
What you really just do is make an incision inside the marshmallow, squirt it inside, and then feed it to your kid.
Is that for the marshmallow?
Yeah, that's what we do, because we make them, they're about this big, they're poofy. And so when he was on the really high concentrated, like sticky tar oil, we would just cut a little slit in this squishy marshmallow thing that's sweet.
Mostly on the side.
And then, yeah, just squish it in there and you would take it. We've used peanut butter. Like right now, unfortunately, we are in a situation where we were only supposed to be here for 3 days, and we're now at 49 days. So I'm not able to go to the grocery store. Okay. I'm not able to go to the grocery store that often. I can't get organic stuff brought here to the Ronald McDonald House. So we've had other things. I've used Sprite, which is kind of gross, but it works. The bubbles help. We use, it's a carbonated water that's got flavor in it. I forget the name of it, but
and also juice concentrates, like the frozen, scrape off just a little, almost kind of like an icy in a way, but that's a concentrate. And you can mix that into whatever you're mixing up, or put half the amount of water that the recipe calls for. So now you have like super orange juice or super apple juice that's just gonna explode all the taste buds like that, and that's another way to kind of to get to work. But a third of the amount of water in or something like that. And I tell people that's not for nutritional purposes. This spoonful of sugar helps medicine go down.
Yeah. So I hope we answered your question, David. Thank you so much for asking it. Do you know of a certification course for cannabis for healthcare professionals? I'm a pharmacist. Please and thank you.
I have not been overly involved in that side because, I'm kind of so self-learned, and, it's when I've looked at those types of things, I realize that maybe there's a tidbit or two that I'll get out of it, but mostly, so I don't really know who the best ones are now, to tell you the truth. I do take my hats off to the realm of caring, the ROC, ROC, which is, was involved in the original Colorado cases with Charlotte's Web and all of that. So I do think that is a good CBD resource. I am also just in general a really big fan of leafly.com. I just think it's the best, most accurate. They're updating their information all the time. Seem very objective. It's very scientifically driven. For me, it's kind of the Wikipedia of cannabis, with actual always right information from what I can tell. Users can't just go in there and edit it. But in terms of being said, this is the conference that I would spend my money and my time on. I can't answer that question. I don't know.
Okay. We also have a lot of dosage questions, which I'm not going to address because you've already said you can't really do dosage over this kind of format. I would encourage others to get a hold of you through your website and stuff like that. Follow-up question for her 8-year-old nephew, please. Okay, so this is following up much earlier. Her autistic nephew is high functioning. He speaks normally and has no problem with eye contact. To look at him, you wouldn't even know he's on the spectrum. As he was in the 3rd grade this last year, we only thought he had authority defiance issues because he wouldn't do his work and had tantrums when he was asked to do something he didn't feel like doing. He's extremely argumentative and doesn't seem to understand that he's supposed to follow directions of adults. He sees himself as a peer to adults. We only found out recently that he is on the spectrum, but still don't know how to help his anger issues, his violent behavior, and the refusal to do things he's not supposed to do. His biggest problem is he's always angry. Can we have a suggestion maybe to help with the emotional side, or is that more where you were saying to go see a therapist?
Well, I mean, again, I think it's peanut butter and jelly, in that I think that those are both important things. So, the general concepts of what we were talking about before, I mean, again, I have seen innumerable number of people on the spectrum who are less explosive, who are less violent, who are more stable, better, easier transitions. Like if an unexpected transition, you realize you have to, when we all could go out all the time, I have to, on the way home from school, I have to stop off at the store. My kid wasn't prepared for that. I have a problem now, because it's not going to be easy to get my kid out of the car type of thing. You know what? That's a place where maybe a few inhalations, so you can be out of the car 5 minutes later. So again, obviously my goal is to be using oral doses that you don't have to go into those rescue moments. So you may not need those rescue moments if you have a good regimen going.
Okay, I have another one here, which is a really good question and something I was going to address myself at the end of this, but I think it's really good to bring toward you. Is she says her son has ADHD and undiagnosed ODD because her pediatrician doesn't believe in that disease.
Okay.
Have tried many different natural approaches for him with multiple professionals. With introducing CBD oil for my son, do you stop doing everything else he is doing? How long does it take to be regulated in his system to know that it's working? He has had great improvements and then back to his normal self of aggressiveness, unfocused, tantrums, argumentative, and so on. We have now been having to do school at home with this COVID-19, and things are getting worse daily no matter what we do. Please help. Well, with us, especially with Ollie, because he was on 4 different anti-epileptics when we put him on CBD. I personally know from a mom's perspective, I'm not a medical professional. I'm just what I call a medical mom, unfortunately, having to deal with this. Don't stop everything right away. Please don't do that. We added it in and waited 3 weeks before we started slowly bringing down one medication at a time. And we took it in one medication he was doing 10 milligrams. So when we started that one, we took it down to 7.5, and then we took it down to 5, and then we took it down to 2.5, then we took it down to 5. It took a whole month to get off of Keppra, to get off of Trileptal, to get off Vimpat, and to get off Depakote. It took us 6 months total to get off of everything and be just on CBD. Don't do that to your kid.
I would like to just put a word out there just from a further consideration. It's easy to do that if a person's just taking one medication.
Right.
But recognizing that there's drug interactions amongst those other things, let alone the cannabis, which I don't know if anybody's aware, but there's almost no medication that's contraindicated to use with cannabis. With not Vimpat, with with OMFI needing to check levels, but pretty much, even though there's some interactions, nothing's considered a major interaction with it's like a handful. But those other medications may interacting with each other. And
Right.
so when a doctor is stacking those medicines, they typically do that in an order for a reason. And or there's a particular effect that they're trying to take care of. And so I do highly recommend it. If your kid's doing so much better that the world is seeing it and you're ready to lower the medicines, any doctor who's not willing to, especially if they saw that the medications in where you were at baseline
Right.
before starting the cannabis, and you're able to show all these changes, notes from therapists, teachers, videos, whatever, bringing your kid in and letting him actually be calm in the office, and then say, okay, I think we're ready to start weaning off medications slowly. You're the professional, you're the expert, you're the one who knows my kids with these medications. Can you please give me what you say would be a very reasonable, not aggressive, approach here that gives us the best chance recognizing those drug interactions that I don't know about. Quite honestly, as a holistic pediatrician, if you're on 4 medicines, I don't know how those drugs are interacting because I don't know drugs that well. I know
Right.
some, but
And
yeah.
that is what we did. Is our
Right.
our neurologist, our second neurologist, was very open, and that's how that's why it took so long to get him off of all of his meds, is we had to go like that with the meds that we were using. So that's what I would say as a mom. Don't do that. Don't just yank your kid off of all the meds. Mainly because pharmaceutical meds build up in your system, and unfortunately, if you stop them, especially not so much ADHD meds, but epilepsy meds. If we were to have taken him from the 25 milligrams of Vimpat that he was on and just stopped it like that, it would have caused seizures.
Yeah.
So, so that's just from my point of view. And then like what Dr. David Berger said is definitely have your doctor, if they prescribed it, they need to tell you how to come off of it.
They're responsible for it.
Yeah, exactly.
Yeah.
See, there's another one that says, we eat a healthy diet, organic, and avoid dairy and sugar processed food. What kind of testing do you suggest for allergies? Blood test was inconclusive. You spoke about genetic testing and stool testing. He was hospitalized when he was 1 year old with upper respiratory tract infection, and we were given IV antibiotics. Will that still affect his gut if they were given IV?
Okay, so an IV antibiotic is going to get to all parts of the body. Okay. In fact, how much of it actually, the colon is where most of our flora is. How much taking an oral antibiotic is because it's not being absorbed and therefore passed through the colon to do its thing, or is the oral antibiotic being systemically absorbed and then affecting all parts of the body? It's probably more likely the second, because they do make these medications to be absorbable, otherwise they wouldn't be doing their job. So, yes, it could. I mean, when I counsel people preconceptually or prenatally, we even talk about whether if there's a chance that you're going to be born, the baby's going to be born by C-section. We even talk to them about, things like vaginal seeding, mom taking her vaginal juices and giving it to the baby orally, which sounds weird until you say, well, if the baby was passing through the birth canal, the baby would have been exposed to those exact same juices right then and there, sitting there for hours in the birth canal. So why is that so weird? Kind of like the first time we heard almond milk. It was sounded crazy. Now we all think of it, but it sounded like a totally weird thing. And now you say, well, when you look at it, how's it, baby would have been exposed anyways. So we're telling them the first day of life, get the baby, start, doing that. Put your juices on the breast, let the baby nurse on it. We're talking to them about probiotics. Again, if the mom was on antibiotics, had groupie strep or some other reason during the delivery, again, her floral counts may be lower, even if it's a vaginal delivery. So we are focusing on the microbiome from day one if we can. Okay. And so, but the thing is, and when you're young, if you knock out the good guys or don't see the good guys in the first place, you may never be able to develop those to just stay that you have to take a probiotic, because the flora that we're born into is a big role as to what our microbiome stays at. So, but yeah, so early antibiotics, and certainly I'd be more concerned about somebody who took the antibiotics 30 times relative to 10 times relative to one time in their life. But yeah, it's all about, did the good guys grow back, or while the good guys were knocked off, did any bad guys grow in? And if the bad guys grew in, are they still there? That's one of the things we find in a lot of our special needs kids, is that their years, my kid has been on antibiotics for 2 years. I'm like, yeah, but your kid was on 10 antibiotics between 1 and 2, and we still see the floral levels off. So, it is my belief that all kids who are on the spectrum and other special needs people have candida yeast problems or clostridial bacterial problems in their gut until proven elsewise. You know, it's one of the, if that's the, it's one of the tier 1 tests that I do. Rarely don't I against. If I had somebody who's a completely macrobiotic, did a natural birth, never took antibiotics in their life, they've been eating healthy, they were started on sauerkraut juice when they were 6 months of age, and they were eating yogurts and all the other kinds of flora stuff, and by the time they're a year, they love their kimchi. Yeah, I'm not too worried about that person having a big candidal overgrowth, but that's not most people.
Yeah. We have another question. She says, I'm so late to this, and so I apologize. My daughter has Downs, but this has little to do with Downs. She's 34 years old and was high functioning until 30 years old. She developed a psychosis, hearing voices, developed catatonia. We tried all kinds of meds, awful side effects, even resorted to ECT that I said I would never do, but it really helped her catatonia. But it continually returns. Doing many natural foods, but still on risperidol. Would CBD oil be a possibility?
Yeah, CBD I'd really have little concern about, okay? And even on the THC side of things, you know, there is very, very rare that whether a person themselves or family members, if they do have some level of psychosis, delusion, schizophrenia, etc., that it could make those things worse. But we tell people, but you stop it right away. It's not going to break this person permanently. If you notice that if someone's getting more delusional, don't keep doing it. You know, so that's why I tell people, even, you know, and it's one of the warnings. It's one of the things that we specifically ask every single, you know, have you had any type of delusions? Do you have any family members develop this type of thing? So we ask every single patient, every single time when we see them who are using cannabis, that very question. But at the same time, I have plenty of people who have psychoses who are like, I'm so much better now. You know, so again, you know, in the risk versus benefit conversation, and knowing that you can stop it right away. And, you know, one of the nice things about cannabis is you go to sleep the next day, you kind of get a reset button, you know. And so, you know, when you're weighing the pros versus cons about something, I think that, you know, again, that's why I keep on coming down to, in almost every situation that I can think of, with the exception of someone with lung problems smoking it, you know, I'm very challenged to think of where the risks would outweigh the benefit, the potential risks would outweigh the potential benefits.
So I just wanted to say thank you. We've gotten a lot of these popping up on the Q&A that are just saying, thank you for doing this. Thank you for addressing it with kids. I know I'm writing a book from my standpoint on kids and cannabis. I know Ollie, my 10-year-old, he wrote a book about getting cannabis as medication. My son Joey wrote one from an autistic kid's point of view. Yeah, that was fun. So it's getting out there more. Thank you so much for what you're doing. Being a pioneer, really. There's not very many pediatricians that are willing to go there with cannabis with kids. So thank you so much.
Absolutely.
For what you're doing.
Well, I hope that I can help, that I've helped some people tonight and at least pointed you guys in some better directions.
Yeah, thank you so much. Have a great night. Get some sleep. Do your chores.
Yeah, thank you very much. Yeah, I'm on dishes, so that's our deal. I do dishes. My wife does laundry. That's our compact.
That would work. That would work.
All right.
So,
have a great day, everybody.
Have a
Bye-bye.
nice day. Thank you so much, everybody, for joining us. Again, this is Shannon with the Sacred Plan. I'm going to sign off. That was Dr. David Berger. Thank you so much for joining us, and we'll see you next time. Have a great day.